Good morning. Welcome to the Take Your Life Back Today show. My name is Ralf Friedrichs. I'm a life coach, addiction recovery coach, and the host of this show, the Take Your Life Back Today show. Folks, you can also see this on YouTube on channel Take Your Life Back Today show. If you go to the search bar on YouTube, you'll find it. Alcohol use disorder. When is drinking a problem, friends? Alcohol use disorder and other substances use problems are considered diseases like any other, but are stigmatized as moral failure by many. Conversations about alcohol use have been center stage in national news. Stories about underage drinking, blacking out, and harmful behavior associated with alcohol use are quite common in many families around the world. The rise of opiate epidemic in the U.S. has rightly caught our attention, but overshadowed as a much more common problem. In the United States, from 2006 to 12, alcohol-associated fatalities accounted for 88,000 deaths annually, or almost 10% of all U.S. deaths. While many people are becoming aware that medication-assisted therapy can help treat opiate use disorder, very few know that medication and counseling can significantly reduce alcohol use compared to with trying to cut back on your own. What is an alcohol problem? Friends, in the U.S., 6.6% of alcoholics reported heavy alcohol use, and 1 in 4 people reported at least one episode of binge drinking. Binge drinking is defined as 4 or more drinks in one day for a woman and 5 or more for a man. Friends, alcohol use disorder, or AUD, and other substance use problems are considered diseases like any other one, but are stigmatized as moral failure by many. The cause of AUD is a complex interaction between genes and environment, with a strong association with other health problems. In one study, 77% of individuals with AUD carried another medical problem, either cancer, liver disease, pancreatitis, or other psychiatric diseases such as depression, anxiety, bipolar disorder, or schizophrenia. A history of trauma, physical, verbal, and sexual abuse is also highly prevalent in the population. Even though genetics play an important role, exposure to specific life events and situations can significantly increase one to seek comfort and reward using alcohol beverages. Recognizing alcohol use disorder, the awareness that alcohol use may be causing a problem does not come easy. Drinking is socially accepted in most places and is frequently used as a social lubricant. Patients are rarely seen coming forward to talk about drinking behaviors. The conversation is usually triggered by friends and family members who urge their loved ones to seek help, as many do not see their alcohol use as a problem. If you're unsure if you or your loved someone has an alcohol problem, ask one question. How many times in the past year have you had 5 or 4 more drinks a day? A response equal to or greater than once identifies an average 8 out of 10 people with AUD. A positive answer should trigger a more thorough visit with a doctor, or at least stimulate a reflection about one's drinking behavior. Treating alcohol use disorder. As with many other chronic diseases, AUD treatment is not as straightforward as taking antibiotics for pneumonia. However, there are several medications that can help patients deal with cravings and reduce drinking. Folks, other drugs that are used off-label to treat AUD include nalmefene, baclofen, gabapentin, and tropamate. Individual and group therapy may also help reduce binge drinking and increased absences. For some people, drinking at night or on the weekend may feel like the only source of relaxation and comfort. It is not uncommon for people who suffer from anxiety and depression to drink to alleviate their feelings and emotions. The treatment of these psychiatric disorders may also help reduce the frequency and amount of drinking. Nonetheless, it may be hard to keep the motivation going. Relapses are a common part of the disease, and successfully overcoming AUD often depends on stability at work, adequate housing, hope for the future, and support from family, friends, and health system. Don't be afraid to seek professional help if alcohol use defines who you are and is affecting your life and relationships. We now have several approaches that may lead to healing and recovery. A simple conversation with your doctor about whether or not you have a problem with alcohol use could be the first step toward a healthier and more fulfilling life. Call me at 844-405-HELP. Together we can help each other take our lives back. Be good to yourselves and always be good to each other. And a simple smile to a neighbor can help that neighbor for the rest of their life, can change your life too. Remember, alcohol is a disease, and too much of it, you will overcome no obstacles at all. And through God, everything is possible. May God bless you, and we will